Hello, I'm Dr. Guy Bernstein, and I'm the Chief Medical Officer of MidLantic Urology. I would like to speak to you today about genetic testing for prostate cancer. Did you know that about 3% of men with prostate cancer will have some type of genetic mutation? However, that percentage increases to 10 to 12% with men who have high-risk prostate cancer disease. A genetic mutation is an alteration in the DNA in the cells of your body. This alteration is something that you could be born with or can change after birth. Sometimes mutations happen in the cancer after it forms. You can identify these mutations through genetic testing. So how is genetic testing done? Genetic testing involves a blood test that looks for changes in your genetic profile. In some cases, the actual tumor can also be tested for mutations. You may wonder how genetic testing information will be used by your doctor and if it will provide any benefit to you and to your family. The results of genetic testing can help determine the chance of developing or passing on certain inherited forms of cancer. It can also help the doctors make medical recommendations regarding the detection and treatment of your prostate cancer. Genetic testing is a valuable tool when checking for certain inherited syndromes that may put you at risk for developing prostate cancer or even other forms of cancer. The one syndrome that is particularly important in urology is called Lynch syndrome, an inherited disorder that increases the risk of a number of cancers, including prostate, colorectal, endometrial, and other types of cancers. You may wonder if your insurance will cover the cost of genetic testing. Genetic testing can be expensive, but most insurance companies, including medical assistance and Medicare, provide some amount of coverage for the testing. MidLantic Urology will verify your insurance coverage before any of these genetic tests are run. People are often worried whether the genetic testing results will affect their ability to obtain insurance or whether their health insurance premiums will increase. A federal law known as GINA, the Genetic Information Non-Discrimination Act, prohibits health insurers from making decisions about whether they wish to cover you or if they will continue with your existing policy coverage or what your health insurance premium will be based on the outcome of your genetic testing. It also protects you should there be a change in your medical insurance plan. One cautionary note, the law does not pertain to life insurance. If you are thinking of obtaining a life insurance policy in the future, it is best to have that plan in place prior to genetic testing. Genetic testing can bring emotional effects. Some patients feel empowered with the knowledge, while others feel overwhelmed with the information provided. We recognize and understand both positions and believe that you should give careful thought to your testing option. It may be helpful to discuss it with family members before making a final decision. You may be interested in discussing this test with a genetic counselor either before or after the testing results are available and to get a better understanding of the potential impact of the results. We can provide genetic counseling if necessary. If you are considering genetic testing, please speak with your provider at MidLantic Urology. We understand that it is a very personal decision and want to help you determine what is best for you. Thank you.